My name is Vasu. I am the medical director of the stem cell therapy lab here at the James and the scientific director of the blood and marrow transplant program. As a cancer researcher, I have the privilege of bringing exciting discoveries from the lab to the clinic where it can impact their lives. Right now, treatments for cancer sometimes can be harsh and have side effects. One of my goals is to help my patients live longer lives, but with a better quality of life. The name of the project is using haploidentical cytomegalovirus-specific T cells for recipients of hematopoietic stem cell transplant and solid organ transplants. When patients go through a stem cell transplant or through a kidney or a liver transplant, we have to give medication to suppress the patient's own immune system. So these patients' immune systems are very weak, and as a result, viruses that have been dormant for years can wake up and cause significant problems. And these infections can threaten the very success of the transplant. So our goal is to use cellular therapy or cells, particularly immune cells called T lymphocytes, to help fight the virus instead of using toxic medications. Thankfully, the technology for making these cells have significantly increased in the last 5 years. We now have an automated process, a machine, it's called the Prodigy, where we can go from loading the cells and generating the virus-specific T cells in less than 24 hours. It's an overnight process which is fully automated, so it does not require a lot of manual time. And because it's an overnight process, we can get the cells to patients very quickly. It will help patients spend less time in the hospital and live better lives because they're no longer dealing with complications from the transplant. And if this platform were to work, we can start making T cells against a whole host of different viruses. For example, there are some viruses called the Epstein-Barr virus where the virus itself can result in a cancer. So if we can come up with immune cells to fight the virus, then we have come up with a novel approach to help fight against these cancers as well. It's a fully closed, automated process. In the morning we come, we detach the bag from the machine, and it's ready to be infused to the patient. We expect the patient to have a response within a week. By doing clinical trials, that's precisely what we do. We are learning more about their disease, but we are also learning about the effects of these treatments on that disease, so we can be smarter about who's most likely going to benefit. And when we discuss these results at national meetings and share our results for the rest of the world, it really has a great impact. If this platform is effective, the patients who got treatment here at the James are informing the rest of the world about what is a good way to treat these serious illnesses. Pelotonia funds help me in two ways. One is the faith and investment from the local community that inspires us to work harder and give back to our local community. And the other is it provides the very necessary preliminary evidence to be competitive for a larger grant from the government.